Do you frequently feel like your heart is pounding really hard, even when you're just sitting down? Or maybe you've had moments when you suddenly felt like you couldn't breathe, and you thought something terrible was happening, like a heart attack. If yes, you might have experienced a panic attack. Now, imagine those feelings happening out of nowhere, more than once, and making you scared to go out or do normal things. That's what panic disorder is. It's not just stress. It's when your body reacts with extreme fear, even when there's no real danger. For example, Sarah, a 28-year-old teacher, once had a panic attack in a grocery store. Her heart raced, she felt dizzy, and she was sure she was dying. After multiple such episodes, she learned she had panic disorder. It's more common than you think and completely treatable. So what causes panic disorder? It's not just one thing. Think of it like a glass filling up with water. Some of the water comes from your genes. If a family member has anxiety or panic attacks, you might be more likely to get them too. Then your brain's alarm system can be too sensitive. For instance, Tom jumps every time his phone rings loudly, even if it's just a call from his mom. His brain overreacts. Big life changes like losing a job, going through a breakup, or constant stress can also pour more water into that glass. And sometimes, even using caffeine or drugs can trigger that first panic attack. Once the brain learns that this feeling means danger, it keeps reacting, even when there is no danger. So panic disorder is like having a smoke alarm that goes off when you're just toasting bread. What does a panic attack actually feel like? Imagine you are on a roller coaster, heart racing, sweating, shaky hands. But now imagine this happens when you are lying in bed or walking your dog. Common signs include chest pain, fast heartbeat, shortness of breath, dizziness, shaking, feeling like you are choking, or even feeling unreal, like you are outside your body. Some people think they are having a heart attack. Others fear they are going crazy or losing control. For example, Maya had a panic attack during a work meeting. She suddenly felt hot, her chest hurt, and she thought she could not breathe. She rushed out embarrassed. These attacks usually last 10 to 20 minutes, but feel much longer. The scary part, they often come out of the blue with no clear trigger. How do doctors know it's panic disorder and not something else, like a heart problem? First, they ask questions and lots of them. They'll check your heart and run tests to rule out physical illnesses. Once those are clear, they look at your pattern of panic attacks. Do they happen suddenly, without warning? Are you constantly worried about having another? Are you changing your behavior, like avoiding elevators or crowded places? That's when they might diagnose panic disorder. The good news, it can be treated. One key treatment is CBT, cognitive behavioral therapy. It's like mental training. You learn to understand your fear, challenge untrue thoughts, I'm dying, and slowly face situations you've been avoiding. Medications like SSRIs can also help calm the brain's overactive alarm. For example, James started therapy, and in 3 months, he was riding the subway again, something he'd avoided for a year. Can panic disorder be prevented? Not always, but you can reduce your risk. Think of your mental health like a garden. If you water it well, weeds grow less. Regular exercise, good sleep, and managing stress help. Avoiding too much caffeine or alcohol matters too. Both can trigger panic in sensitive people. Learning relaxation tricks helps a lot. For instance, slow breathing. Breathe in for 4 seconds, hold for 4, breathe out for 6. Practice when you're calm, so it works when you're stressed. Also, if you have one panic attack, don't ignore it. Talk to someone. Early help can stop it from turning into a pattern. Like Lena. After her first attack, she saw a counselor, learned tools, and never had a second one. Scientists are learning more One cool advance is using apps and VR, virtual reality, in therapy. Imagine facing your fears in a safe space, like a virtual bus or elevator, using a headset. Studies show this helps people feel more confident in real life. Another new idea is focusing on the brain's fear network, parts of the brain that light up during panic. Researchers are testing ways to calm this with neurofeedback or meditation. Also, personalized medicine, finding which treatment works best for your unique brain and body, is becoming possible. For example, some doctors now use genetic tests to choose the right medicine faster. These advances mean fewer guessworks and quicker relief.